able to apply the methods of massage in order to influence a specific physiological outcome is the basis for lymphatic drain massage. You have to understand the anatomy and physiology of lymphatic movement to understand why dragging the skin to the bind opens the lymph capillaries and facilitates lymphatic movement. There are many theories about what is appropriate for lymphatic drain. The method presented in this DVD and text is a combination of all of the methods as they make sense to anatomy and physiology. What's being demonstrated is the basic skin drag technique. The pressure is enough so that the skin is dented, a level 1 pressure, but you do not slip on the skin. You drag the skin to a binding sensation and then let it return back. Direction becomes a factor as well. In general, moving towards the closest cluster of lymph nodes is appropriate. In instances of severe lymphedema, there are specifically trained therapists to manage those conditions. Massage therapy in general can be targeted to move fluid. What you are seeing is how the hands are placed on the skin to cover a large area in order to move the fluid. Another aspect of lymphatic drain is a pumping action at the joints. Being demonstrated here is the use of a pillow. When working with lymphatic drain, you want to think of a very rhythmic application. The hands are placed in a broad contact, moving the skin in either a linear movement or a circular movement just to drag the skin. Being demonstrated is how my body actually provides the movement. Once the hands are placed, they will drag the skin forward and back or round and round. The circular movement is often called stationary circles. Again, we're seeing how the pillow can be used to facilitate the pump aspect of lymphatic drain. When thinking of water, fluid movement, water flows easily downhill, so positioning becomes very important. And now that we understand the basic movements of lymphatic drain, we typically will start with the client prone, but sometimes supine is appropriate as well, and decongest the thorax with compression and kneading just to make sure that the tissues are pliable. Divide the body at the waist. And then methods above the waist head towards the axial area. Again, positioning the hands so a broad contact is applied, and use the skin drag method. Again, mark the waist area, and methods below the waist in general would flow towards the groin. The deeper lymphatics can be addressed with slow, rhythmic kneading. Joint movement becomes a pumping mechanism to move the fluids. Oscillation is an extremely effective method for moving the lymphatic fluids. It is underutilized. Compression on the hand and the soles of the feet stimulate major plexuses in the area and facilitate the lymphatic pump action. Move back and forth among the methods, the drag method, the kneading method, the range of motion, and pumping actions at the plexuses. Pumping can also be applied to each one of the joints. Side lying position is an effective way to work with lymphatic drain. Side lying position is the best method for lymphatic drain of the thigh to facilitate fluid movement down a hill. The rhythmic pumping can also be utilized in this position. And rhythmic compression to the plexuses of the bottom of the feet are an aspect of lymphatic drain. When the client is in the supine position, we would utilize similar decongestion methods to the thorax. These are combinations of compression, rhythmic rocking, kneading, in order for the tissue pliability to support the vessels. Decongesting of the thorax allows for the vessels to have enough room within the tissues to be able to allow the fluid to flow within them. Rib springing also is a way of pumping similar to we find at the various joints or on the soles of the feet to facilitate lymphatic fluid deep into the body. Another principle of lymphatic drain, particularly targeted to the fluid in the deep vessels, is deep breathing. In this example, I'm facilitating the compression pumping action while the client breathes deep. Using bolsters to prop the leg above the heart slightly, adding a little bit of the oscillation movement begins to prepare the area for lymphatic drain. Begin close to the torso and work out distally. Rhythmic range of motion allows us to pump the lymphatic vessels at the joints where the nodes cluster. Being demonstrated as a way that the nodes can be accessed in the groin area. Compression to the plexus of the foot and rhythmic range of motion of the ankle stimulates the movement of the fluid in the calf muscles.